I was born in Edmonton, Alberta, to a mom who was a nurse and a dad who was a surgeon. Did Red Deer College for 1 year, went to university in Edmonton, Alberta, and then subsequently did med school in Edmonton, Alberta. Finishing med school, my dad was a head and neck surgeon, so I went into head and neck surgery, and one of the ski coaches that I worked with was a facial plastic surgeon, so I subsequently followed his footsteps and did a fellowship in Chicago for 1 year with the world's most renowned rhinoplasty surgeon at that time, and then went to Switzerland and worked with the greatest facial recon surgeon in Europe at the time, and was seduced into coming back to Vancouver. Since I've been in Vancouver for the last over 30 years, I've specialized primarily in just facial plastic surgery. When I first see a patient for a consultation, the first thing that we really need to do is make them at ease so they can talk. I think of myself as being slightly funny, if nothing else, and typically laughter is the best medicine and makes them feel comfortable, and we want to find out what their biggest concern is and whether or not it can be addressed. And some people come in and they're rather vague about what they want to achieve, but that's really what I need to know. And if they tell me what they really want, then we can address the face that they have and determine whether or not we can provide the goods. And when you're talking about a patient's changing surgery, I feel more like a psychiatrist than a surgeon. Surgeons are pretty black and white, and things are right, things are wrong, but psychiatrists are there just to chat. And I'm there to chat and to make them feel comfortable. And even still, there's some tough patients who've had bad experiences before. But I come from a background, mom a nurse, dad a surgeon, grandma a nurse, and I think I can relate to most people. And so I try to make them comfortable just by getting them to chat about themselves and their family, and then we dive into the aspect of what surgery you want and whether it's a good idea or not. With regards to facial rejuvenation, the problem that we have currently right now on the planet is social media is such that people who are too young are coming in and asking for some form of anti-aging surgery, and I may dissuade them from having that surgery if they're too young and they're not going to get a positive benefit. But if there is a positive benefit, they're well motivated, they understand what they're getting into, it's a reasonable thing to do. The most rewarding thing about my work is a happy patient. Is getting a patient coming in and giving me a hug or a handshake and saying, I didn't think this was possible, and look what you've done. And this is beyond my wildest expectation. And we get a number of patients who say just that, because they've been online, and online can be a minefield for many people, and you start hearing about disasters occurring this, that, and every place else. And it's nice to have patients who are very, very happy, particularly those who've had previously bad results or bad experiences, and you can fix something that has occurred to them that is not ideal. And those are the happiest patients. The one thing that we really practice on an ongoing basis, minute to minute, is honesty. You have to be principled. You have to be honest with the patient. If it's a patient you can't improve, you do not operate. But really, it's honesty in telling the patient really whether or not we can improve things for them, whether we can help them, how much we can help them, what to expect with the result. And that's germane to being a facial plastic surgeon. No, I didn't. I come from a Scottish family that comes from the Perth area of Scotland, and Younger is a very common name in Scotland. And the largest brewery that produces beer in Scotland is Younger's Tartan Ale. And my dad was praying to Almighty God that he was related to Younger's Tartan Ale, but that indeed was not the case. So I came by the name honestly.